Okay, our topic for today would be histology of the digestive system and accessory organs. Okay, these are the learning objective, intended learning outcomes to describe the segments of the whole digestive tract, to discuss the layers of the wall, specifically the histological layers of the digestive tract, and to describe the histology and functions of the accessory organs. So in medicine, these two are both separate topics, no? But for histology, isa na natin. Okay, so let's start with this picture. Okay, in the left side of the screen are your accessory digestive organs. These are the salivary glands, and we have three. We have the parotid, sublingual, and submandibular, which will be discussed in detail in a while. You have the liver, the gallbladder, and the pancreas. They are accessory digestive organs. But for the digestive organs or GI tract, it begins at the oral cavity, down to your pharynx, your esophagus, your stomach, your small and large intestine, and down to your rectum. Okay, so let's first discuss the gastrointestinal tract. It begins with the oral cavity. Okay, now the lining epithelium of the oral cavity is stratified squamous non-cornified epithelium. And the oral cavity in general. But if we ask you what are the organs found in the oral cavity that are aligned with this one, stratified squamous cornified, these are the following: hard palate, your gingiva, and your filiform papillae of the tongue. Okay, so again, generally there are stratified squamous non-cornified, but these three structures found in the oral cavity are cornified epithelium. Okay, at the submucosa of this oral cavity, you will find lips, the cheeks, and the soft palate. But for the hard palate, there are no submucosa, and the mucosa of the hard palate is firmly bound to the periosteum. Nakadikit sa buto, kaya nga hard palate sila. Okay? In the oral cavity, it is divided into two. You have the oral cavity proper and the oral vestibule. And the communication between those two is what you call the retromolar space. Okay? All right, so Shepard, let's start with the outer. Now we have the upper and the lower lips. And as you all know, it's the skin, and that is lined by stratified squamous cornified epithelium, the upper and the lower lip. It is actually considered superficial fascia, but the submucosa of these lips contain mixed secretion. So pwede silang mucus, pwede silang serous, and that is because of the small salivary glands called your labial glands. Okay? The medical term for lips is labial. Okay? It is of mixed secretion. As I've discussed, or as I've mentioned, the mucosa, which starts with the lining epithelium, is stratified squamous non-cornified epithelium. Doc, ba't ganun? Pag sa skin, sa labas, it's cornified, pero pag sa mucosa na, sa loob ng lips, it starts to become non-cornified. Okay? Take note of that. Sa labas would be cornified. The mucosa is non-cornified sa loob. Okay? There are no hair follicles, no sweat glands, and no sebaceous glands sa lips ninyo. Kung may makita kayo ng hair, no, wala yan. It's rare. Walang sweat glands dyan, walang sebaceous glands dyan, walang hair follicle ang labi. Kaya nga labi, kaya labial glands. Okay? So ano pa? The cheeks. Of course, outside of the cheeks is the skin. It's stratified squamous cornified epithelium. Its superficial fascia, no more inner, ng layer ng cheeks would be composed of the buccal pad of fat. Okay? Buccal pad of fat. Ito yung mga yung masarap kurte na cheeks. So these are the buccal pad of fat. The bucopharyngeal fascia is composed of the buccinator muscle. This is for chewing. The buccinator muscle is for chewing. Now, the submucosa of our cheeks contains a tubuloalveolar small salivary glands called Obviously, if you have labeled glands, lips, in the cheeks, it's called the buccal glands. And they're also of mixed secretion. Okay, Dok, but ayun naman, mucosa na naman is lined by stratified squamous non-cornified epithelium. Yes, kasi sa loob na siya. Pag sa labas, it's cornified, pero pag pumasok na sa loob, the mucosa is non-cornified. But still, it's stratified squamous. Okay? Okay, so from outside, let's go now to their inside. Of course, your tongue, the upper surface of our tongue is composed, or it contains your lingual papillae. And the tongue is composed of 4 different types of your papillae. Please take note of this. The most numerous papillae or lingual papillae is the filiform papilla. Okay, that's the most numerous. They're filiform. Your fungiform is you have a constricted base and you have an expanded surface. Type of papilla, you have your fungiform papillae. Leaf-like papillae, or this is rudimentary. This is actually common sa animal, not much common sa humans. You have your foliate. No? If filiform papillae is the most numerous, the largest is the circumvallate papillae. Okay, and that contains your taste buds. Okay, what else? So, under surface of the tongue contains your salivary glands, and we call that your lingual glands. Take note of the term. If it is found anteriorly, these are called your anterior lingual glands, and we otherwise known as the blandine and non. Right? There are the blandine and non. They are your anterior lingual glands, and they are mucoserous. Now they are of mixed type. Your von Ebner's glands, or their von Ebner's, they are your posterior lingual glands, and please take note, class, they are purely serous in secretion. Okay, they are both lingual, depends on the location. If it is anterior, it's more mucoserous, and if it is posterior, it is purely serous. Okay. All right, so this is just a picture showing you our tongue. So this one is the dorsal surface of the tongue. This one is the apex. And this one is the body. The roof of the tongue is almost always nandun siya sa tonsillopharyngeal area. Now look at these tonsils. These are the commonly involved tonsils if you have tonsillitis. No? Pag check nyo pa lang sa tongue, sa oral cavity ng pasyente natin, kita-kita na kapag namamaga ito. Minsan dalawa pa, hanggang dito sa may space na to, maga yung tonsils. And usually, this is treated with antibiotics. Now, for the oropharyngeal swab for COVID-19, ito po minsan, yun, ang sinuswab. No? Nagagag ka ba minsan? Yes. No? You have gag reflex kasi kinukuha dito yung sample. Alright? So these are the different papillae, and the largest of which is the circumvallate. Yeah, so this is a histological characteristic of your papillae. It's stratified squamous. This is actually the connective tissue, and if you notice, these are the taste buds. Now, sabi natin, nawawala daw yung taste kapag nagkakaroon ng COVID-19. Not necessarily lahat ng COVID-positive patients may loss of taste. Okay? Most prominent pa rin yung loss of smell or sense of smell. Okay? In this picture, if you notice, you have your gustatory microvillus, and these are the nuclei of the gustatory cells or of supporting cells of your taste buds. Okay, so after the lips, the cheeks, let's go now to your gums. Your gums, it is lined with stratified squamous, take note, cornified epithelium. The mucosa is actually adherent to both of the mucoperichondrium and the mucoperiosteum, either at the cartilage or at the bones. And the mucoperichondrium, sabi natin kapag perichondrium is more of a cartilage, they are composed of dense collagenous or dense connective tissue. Okay? Okay. So, syempre, kung wala tayong ngipin, wala tayong pang-grind ng kakainin natin. We have two types of teeth. You have your temporary and your permanent. Now, please take note of this. Your milk teeth or your deciduous teeth, there are of 20 in number. They're usually first erupt at 6th month and they will continue to erupt until your 6th year. So kung may kapatid kayo or cousin kayo or friends na bata no? 3, 4 years old, bungi na agad, don't worry. Okay? The temporary teeth will last until 6th year and usually the permanent teeth, there are 32 in number. They will first erupt from the 6th year until your 25th year. So hanggang ngayon, may tumutubo pa ring ngipin sa inyo. Ano yun, Doc? So these are your set of teeth. Yan. Huwag muna natin itong pag-usapan. Let's first describe the parts of the teeth. So the enamel, that's the hardest structure of the body that's secreted by the ameloblast. Iba rin ang dentine that they are formed by odontoblast. So saan ang dentine dito? This is the dentine. Yung white surface na yan. Iba ang cells na nagproproduce niyan at iba din ang enamel. Yeah. So cementum covers the dentine of the root. No, they are secreted by cementocytes. And the periodontal membrane is actually serves as the attachment of the root of the tooth to the alveolar sac. Now, in the pulp cavity, it contains blood vessels and nerves. Kaya kapag nagpapabunot tayo or if you have tooth extraction or prophylaxis, very sensitive. Now, especially kapag nagpapa-oral prophylaxis ka lang. But if there is bunot, no, kailangan talaga ng anesthesia. And these are the parts of the teeth. If you look closely, if this is the cementum, katabihan ng dentine, and at the upper portion is just the enamel. Yan, the hardest, nasabi dito sa description, hardest structure of the body. So this is the crown, the neck, and the root. So the root contains so many, yung periodontal ligaments na yan, kaya nakakabit siya sa mismong dentine. Okay? Doc, ano po yung root canal? No, huwag niyo naman sabihin i-root canal kayo. Okay? This is just a procedure. But the root canal itself, meron tayong lahat root canal. Okay? This root canal contains nerves, blood vessels. Look, no? Na the whole stretch of a tooth is meron talagang root canal. So if ever si dentist nagkaroon ng procedure dito, hindi pa masakit, right? Nakakangilo lang. Pero kapag na-touch na dito, of course, sisigaw ka na sa sakit. Kaya kailangan ng anesthesia na dapat papasok sa pulp cavity. Doc, ano yung pulp cavity? Look, itong pulp cavity contains so many blood vessels, nerves, and yun, mga nerves. Kaya pag may anesthesia dito sa pulp cavity, hindi ko wala ka na mararamdaman. No? Involved na yun hanggang dito sa baba. Okay? So, nakakangilo because of the presence of the nerve near the pulp, near dito sa dentine area. So kahit nagtutoothbrush ka, hindi masakit. Nakakangilo sometimes kapag hard toothbrush ang ginagamit mo, pero kapag may dental procedure at naabot niya yung pulp cavity which contains the nerve, masakit. Okay? Now, what are each tooth called? So you have your central incisors, your lateral incisors, your canine, your first, your second, premolar, and your first, your second, and your third molar. Now, mind you, usually kapag nagbe-braces ka, braces, this is just for orthodontics kapag may mga kailangan kang i-realign na ngipin. Usually, ang tinatanggal would be the third molar. Okay? Tinatanggal natin yung third molar na yan. Why? Kasi para mag-adjust itong nanditong ibibraces. So, kapag ibibrace kayo, huwag mong sabihin arte lang yan. No, there is ongoing realignment, no, or correction. Kasi minsan kapag suki-suki, hindi magkakaroon ng adjustment kung hindi mo tatanggalin yung third molar. And this is actually a major, not major na nasa OR cap, pero an operation na dentist kailangan mo talagang tagalin to adjust yung teeth, either it's upper or lower teeth. Okay? Okay. Any questions in the oral cavity? Now, just as your questions after the lecture, let's go now to their alimentary tract. So, just the GI tract. Now, honestly speaking, ito talaga kailangan yung tandaan. There are 4 layers in the whole stretch of the digestive tract. You have your mucosa, your submucosa, your tunica muscularis, and your tunica serosa, or tunica adventitia. Your mucosa is composed of your epithelium, your lamina propria, and the muscularis mucosa. And you all know this, no? This is actually before pa prelims midterms topic na kapag mucosa ang pinag-uusapan natin, you have the lining epithelium, the lamina propria, and the muscularis mucosa. Okay? Now, for the submucosa of the digestive tract, there are submucosal glands. Okay? You have your submucosal glands and you have your submucosal nerve plexuses. Alam ko wala to ngayon sa handout ninyo, but please take note. Okay? Please take note. The GI tract, lahat ng glands, okay, all glands in the GI tract are only found at the lamina propria. Okay? They are only found at the lamina propria. Lahat ng glands. Okay? Lahat ng glands sa digestive tract or gastrointestinal tract are only found at the lamina propria except number 1, esophagus, and number 2, duodenum. Okay? All glands are found at the lamina propria except number 1, esophagus, and number 2, duodenum. In the esophagus, the glands found in the esophagus are at the lamina propria and at the submucosa. Okay, mamaya, i-explain natin. And at the duodenum, your glands are found, number 1, at the lamina propria and number 2, at the submucosa. And you call the glands at the submucosa of duodenum your Brunner's glands. Okay, sulat niyo yan. Mamaya, babalikan natin siya. Okay? Alright, so in the submucosa, there is this submucosal nerve plexuses. Nakita niyo yung yellow na yan? Para saan yan? This is for secretion. Okay? And these are what we call your Meissner's plexus. Okay, Meissner's plexus. In the tunica muscularis layer, we all know that this is composed of muscle. Okay? Smooth muscle. So if this is the inner circular, this is the outer longitudinal, look at this one. Mas malalaki yung nerve fiber dito. And we call this one as your myenteric nerve plexus or Auerbach's plexus. Mamaya makita niyo yung spelling. Now, just an overview, what is the function of these nerve plexuses that are found in between the inner circular and outer longitudinal is for motor or peristalsis. Okay? This is one of the most common questions asked in the practical exam. Kapag nakita kayo ng dalawang muscle layer or nasa tunica muscularis at nerve plexus to, obviously sasabihin mo, uy, kapag nag-stimulate ang nerve plexus na to, magkakaroon ng contraction. And that contraction per se is your peristalsis or movement of your food along the digestive tract. And you have the tunica serosa. Okay, sorry for the text. This is just a review. We have the mucosa, submucosa. Tunica muscularis is also known as your muscularis externa. Now, one of our classmates asked me, what's the difference between tunica serosa and tunica adventitia? When I say tunica adventitia, okay, sulat niyo ulit, tunica adventitia, that both are outermost layer. Okay, a difference niya is that the tunica adventitia, the part of that organ is adherent, no? Nakakabit sa isa pang organ. But the tunica serosa, ang tunica serosa is freely, no? Walang nakakabit at nasa peritoneal cavity sila. That's the difference between tunica adventitia and serosa. Again, adventitia is adherent to any organ, while your serosa is freely, no? Na walang nakakabit pero nasa peritoneal cavity sila. Okay, so let's start with the esophagus. Okay, esophagus, its lining epithelium class is stratified squamous, non-cornified, or non-keratinized epithelium. At the lamina propria, you may find loose connective tissue, and as we all know, meron din siyang loose lymphatic tissue. And at the lamina propria of the esophagus, we call the esophageal glands as your superficial esophageal glands. Okay, your superficial esophageal glands. And the muscularis mucosa is composed of smooth muscle. Okay, look at this picture. SS stands for stratified squamous. This is the lamina propria, which contains your lymphatic tissue, loose lymphatic tissue, and this is the muscularis mucosa. Now, Doc, asan dyan yung superficial esophageal glands? Mamaya, papakitaan ko kayo. Ito. This is your superficial esophageal glands. If you notice, this is the lining epithelium, the stratified squamous, the lamina propria, and this is the muscularis mucosa. Right? So from this tip of the pointer up to this area is your mucosa. This structure is called your superficial esophageal glands. Doc, sabi mo, di ba, lahat ng digestive organs, ang glands nila nasa lamina propria except esophagus. Now, this is another exception. This is the submucosa. Okay? Wala talaga dapat makikitang glands sa submucosa ng GI tract except esophagus. And we call this one, if this is superficial esophageal glands, this is your deep. Okay? This is your deep esophageal glands. Okay? This is your deep esophageal glands. And this area right here is known as your tunica muscularis. No, nakita niyo yung orientation ng fibers ng muscle. This is inner circular. This is outer longitudinal. Tignan natin. All right. So at the submucosa, as I mentioned, it's composed of dense irregular connective tissue. It contains our Meissner's plexuses. So again, Meissner's plexuses, they are responsible for secretion and the GI tract, especially at the esophagus. But the deep esophageal glands, that's one of the characteristic feature of the esophagus. Kasi nga, wala naman talaga dapat glands sa submucosa. And we call the glands at the esophagus in the submucosa as your deep esophageal glands or esophageal glands proper. Okay? Okay, what about the tunica muscularis? So pang third layer ng esophagus. It is composed of your inner circular and outer longitudinal. ICOL, para madaling tandaan. ICOL. You have inner circular and outer longitudinal layer. Now, all I need you to remember in this slide are the following. Okay? The whole stretch of your esophagus is composed of three parts. Okay? You have here the upper third, your middle third, and your lower third. This is one of the favorite questions asked in the theoretical exam. Now, what is the composition of muscle found at the upper third of your esophagus? It is your skeletal muscle. Okay? As you go down, the middle third, it's composed of a combination of your smooth and skeletal muscle, where the lower third of your esophagus, specifically at the tunica muscularis, it's purely smooth muscle. Okay? Take note of that. Now, in between, in the inner circular and outer longitudinal, you may find these plexuses. And as I mentioned, the mesenteric or Auerbach's plexuses. And they are responsible for peristaltic movement, motor movement, or peristalsis. Anyone is acceptable. Any answers are acceptable. Okay? Peristalsis. And then the tunica adventitia, it is just composed of loose connective tissue. Okay, so as a review, This is your lining epithelium, your lamina propria, and your muscularis mucosa. That is the specific layer. But if I ask you, identify the layer from this area to this area is your mucosa. From this area up to this area, what is the layer pointed? It is your submucosa. And your answer, if I ask you, identify the structures pointed, you'll answer your deep esophageal glands or your esophageal glands proper. This one is your superficial esophageal glands. Another question, identify specific layer pointed, lamina propria. Identify layer pointed, submucosa. What is the nerve plexus found in this area? You will answer Meissner's plexuses. What is the function of this Meissner's plexuses? Responsible for secretion. Okay, in here, this is inner circular and outer longitudinal. What type of muscle is found on the upper third of this organ? You'll answer skeletal. What is the type of muscle found in this area? Middle third of this organ. You have both skeletal and smooth muscle. While what type of muscle is found in the lower third of this organ? You'll answer smooth muscle. And obviously, this one, if you notice, this is found in between the inner circular and outer longitudinal of the esophagus, specifically the tunica muscularis. This is responsible for peristalsis. And what type of nerve plexus is that? It's the myenteric or Arbax plexus. Okay. Now, another picture showing you the esophagus. No? These are your stratified squamous epithelium. This is a superficial esophageal glands. Paano ko malaman na superficial to? Kasi if this is the muscularis mucosa, it divides the lamina propria to your submucosa. And if you notice, napakalawak ng deep esophageal glands. If you find this at the practical exam, automatically you answer esophageal glands proper or deep esophageal glands. This is the tunica muscularis and this is the tunica adventitia. Okay? Okay, this is a picture showing you the transition. No? Look at the lining epithelium here. Magkapares ba sila dito? Tsaka dito? Hindi. In the esophagus, this is your stratified squamous. Kaya nga E, esophagus. This is your C. Ano bang organ after the esophagus? It's the stomach. The GP stands for gastric pits. Diyan lumalabas ng secretion from these glands. And basically, maraming secretions yan, which will be taught to you in a while. C stands for the cardia of the stomach. That is a part of the stomach that is totally adherent to your esophagus. And what do you call this area right here? This is your esophago-gastric junction. Yan, junction yan ng esophagus at ng cardia. Now, if this is the junction of your esophagus and stomach, this is the lower third of the esophagus. Now, if I ask you, what type of muscle found at the tunica muscularis in this part of the esophagus, you will answer smooth muscle because smooth muscle occupies lower third of the esophagus. Okay, this is just another picture showing you the different layers of your esophagus. Now, in this picture right here, this is your inner circular and this is the outer longitudinal. So this nerve plexus right here controlling your peristalsis is known as your myenteric or Arbax plexus. Okay? Kapag na-stimulate yan, mas-stimulate yung contraction ng dalawa, so magkakaroon ng paggalaw ng intestine and we call that peristaltic movement or peristalsis. Kaya nga siya nasa gitna ng dalawang muscle. Okay? Alright, so let's go now to your stomach. Okay? Your stomach, let's start with the mucosa. And in the mucosa, you may find so many gastric pits or your foveola gastrica. The rugae are your structures found in the stomach, yung mga involutions niya sa mucosa. The lining epithelium of the stomach is simple columnar. Okay? I'll give you a clue. From the stomach down to your large intestine, your lining epithelium, para hindi na kayo malito ng lining epithelium, it's simple columnar. Okay? But stomach alone, its lining epithelium is simple columnar without goblet cells. But if you answer simple columnar, that's fine. Simple columnar without goblet cells, that's fine as well. But from the duodenum, that's the small intestine, down to your rectum, which is down to your large intestine, the lining epithelium should be complete. It's simple columnar with goblet cells. Okay? Pag walang goblet cells, mali. Kapag tinanong namin, what is the lining epithelium of the stomach? Just answer simple columnar epithelium or simple columnar without goblet cells. But from the duodenum down to your rectum, it is your simple columnar with goblet cells. Okay? Understood? Now, the lamina propria of the stomach. Doc, may sinabi ka kanina, dalawang area lang sa GI tract ang may gland sa submucosa. Yes, that's the esophagus and duodenum. Stomach, ang glands sa stomach is what we call gastric glands. And they're only found sa lamina propria. We cannot find glands at the submucosa. Tandaan niyo yan, kaya naka-red. There are no gastric glands at the submucosa. We can only find glands in the lamina propria. Saan na yun? Yeah, lamina propria. The muscular mucosa of the stomach, dun sa mucosa, is ICOL, inner circular, outer longitudinal. Now, this is histological characteristic of the stomach. This area right here is the mucosa. If you notice, may mga gastric pits yan. No? The lamina propria, actually, the gastric glands occupies the whole lamina propria. Now, if you notice, from this tip of the pointer up to this area, ito yung submucosa. And you will not find any gastric glands at the submucosa. They are found only at the lamina propria. Okay? Yeah. So if these are your glands, your cardiac glands sa lamina propria, the secretions of which dadaan sa gastric pits, lalabas sa gastric pit para ma-digest yung food na dito pa lang sa stomach, meron ng process of digestion. Okay? Yeah, this is another picture of your gastric pits. No, para kapag nag-snorkel, kapag may mga ganyang sa seabed, nakita mo na mga ganyang butas, those are your gastric pits. Now, in histology, if you look closely here, this is the lamina propria. Nakita niyo yung mga cells na yan. These are the characteristic cells of our stomach. Mamaya pag-uusapan natin yan. Kapag nag-release sila ng secretion, dadaan yan sa gastric pits. Yan ang gastric pits ng stomach. No? Napakadaming glands sa lamina propria kasi lahat ng secretions dyan dito lalabas in the gastric pits. Again, gastric glands are only found at the lamina propria. Okay, so in the stomach, we still can find blood vessels at the submucosa, lymphatic vessels, and they're also of loose connective tissue. But at the submucosa, meron pa ding Meissner's plexus responsible for the secretion. And no glands at the submucosa. In the tunica muscularis this time, take note, sa esophagus, ICOL, no? ICOL. But in the stomach, it's inner oblique. Ito po yan, inner oblique, middle circular, outer longitudinal. That's the orientation of the smooth muscles found at the tunica muscularis of the stomach. It's inner oblique, middle circular, outer longitudinal. Okay, in between those layers or in between those muscularis orientation, you may find Auerbach's plexus or myenteric plexus. Doc, meron naman din sa stomach. Actually, the whole stretch of GI tract, merong mga plexuses. And the tunica muscularis, nerve plexus, is the arbax plexus. As I mentioned, it is for peristalsis or motor movement. And you have the tunica serosa. Ito yon. Kapag serosa, wala naka-adhere sa kanya. Okay, I made this table for you to study it more easily. Now, these are your gastric gland cells. You have the mucous neck cells. The other term for chief cells are your principal cells or your zymogenic cells. You have your parietal or oxyntic cells. These are your parenchyma or the characteristic cell. And you have your endocrine or argentaphine cells. Now look, no, pakitandaan, pakilagay ng mark. The parenchyma of your stomach is parietal or oxyntic cells. No, yan nga, nakasulat, parenchyma. Pero the chief cells or principal cells or zymogenic cells are the most numerous cells in the stomach. Okay? Parietal cells ang parenchyma, yan ang bida, pero ang pinakamarami would be the chief or principal cells. Okay? Understood? Now, let's have the cell characteristics, staining reaction, and secretion. Dito na muna tayo sa mucous neck cells. They are your columnar cells. Di ba? Simple columnar epithelium ang stomach. There are columnar cells. They are pale in staining. And obviously, kaya nga siya mucous neck cells kasi they secrete mucus. Okay? What about the parenchyma? Your parenchyma, they are described as being a pyramidal or spheroidal. They are red, meaning they are acidophilic. And they secrete the following secretion. Hydrochloric acid is 1, and number 2 is the intrinsic factor. Okay? Tandaan nyo yung mga secretions and staining reactions. Okay? That is the parenchyma, the parietal or oxyntic cells. What about the chief cells or principal cells? They are cuboidal in shape. They are most numerous. They are basophilic or they are blue, and their secretion is pepsinogen. Okay? Their secretion is pepsinogen. Yan. So these are your parietal cells and chief cells. Pakita natin yung itsura because these are commonly asked questions sa practical exam. And we use this slide as well. Okay? Your parietal is, as I mentioned, they are acidophilic or eosinophilic. They are large, round, pyramidal in shape, and their secretion is hydrochloric acid and intrinsic factor. So, class, ang intrinsic factor is actually a glycoprotein released by these cells, and they are required for the uptake of vitamin B12 in the small intestine. Without intrinsic factor, you will develop vitamin B12 deficiency. Okay? Basically, if you don't have intrinsic factor, if your parietal cells are damaged and you don't have intrinsic factor secretion, wala ka nang i-uptake na vitamin B12 pagdating niya ng small intestine. Okay? Kasi kapag, normally, kapag may vitamin B12 na i-intake ka, i-uptake niya ng intrinsic factor sa stomach pa lang. Pero the absorption or uptake would happen in the small intestine. But if you don't have parietal cells, you don't have intrinsic factor, you will develop vitamin B12 deficiency. Okay? Yeah. So this cells pointed right now are what we call your parietal cells or your oxyntic cells. They secrete hydrochloric acid and intrinsic factor. Look closely, no? Bilog na, red pa or pinkish. Now, ano kaya itong mga blue na to? No, mas marami yan sa pink na malalaki. So these are, the blue ones are called your peptic cells or your chief cells. Okay? Can you appreciate yung malalaking bilog na yan, na malalaki yung cytoplasm and your nucleus? Those are your parietal cells and they are your parenchyma of the stomach. Okay? Next would be the peptic chief cell or zymogenic cell. And as I mentioned, they are the most numerous. They secrete pepsinogen, and sorry, not just pepsinogen, they also produce gastric lipases. Okay? Not just pepsinogen, they also produce gastric lipases. This is responsible, lipases are responsible for breakdown of your fats. Okay? Now, ano yung pepsin, Doc? What's the difference between pepsin and pepsinogen? Pepsin is they will initiate the hydrolysis of ingested protein in the stomach. So, pepsinogen, kapag nag-act upon ng acid ng stomach, nagiging pepsin na siya. So, pwede niya lang i-hydrolyze or i-digest yung protein. While your gastric lipases will digest lipids or yung fat in our diet. Okay? So, parehas, kailangan talaga ng parietal cells and peptic or chief cells sa stomach. Okay? The cells pointed right now are your parietal cells. And as I mentioned, the blue ones, which are the most numerous cells in the stomach, they are your peptic or chief cells. Okay, so those are the cells of the gastric glands. Now, as I mentioned kanina, saan nakikita ang gastric glands? Gastric meaning stomach. They're only found at the lamina propria. Okay, and there are actually several glands found in the stomach. Let's start with your cardiac glands. Now, the cardiac glands that's the most proximal to the esophagus. Their glands are your simple tubular glands. The terminal end is long and cold, and the gastric pits are short and shallow. So would you imagine a shorter gastric pits pero yung end niya is long? So they are mostly mucus secreting cells. What do you mean by that? Mucus neck cells ang predominant ng cardiac glands. The parietal cells and argentaphin cells, oops, sorry, I forgot to discuss this, sorry. I'll go back to the last part of the table. This one, the endocrine or argentaphin cells, they're only found kapag nagkaroon ka ng silver and chromium staining. Okay? Hindi siya nakikita ng simple H&E stain. Simple hematoxylin and eosin stain, that's your H&E stain. Ito po lang ang nakikita. Mucus neck cells, chief cells, and parietal cells. But for the endocrine or argentaphin cells, you need special stains, such as your silver and chromium stains. Basically, their secretion is serotonin, histamine, and gastrin. Okay, gastrin promotes acid secretion, while your serotonin inhibits your gastric secretion. Okay, sorry, forgot that. Okay, going back to the glands. After the cardiac glands, so these are the cardiac glands. Ito po, malapit sa esophagus. Let's go now to your fundic glands. Where are fundus? This is the body. Yun, sorry. The fundic glands, what are the characteristics of your fundic glands? They are the most numerous type of gastric glands. They are your simple branch tubular glands. And if they are the most numerous, all you need to remember is that all 4 types of cells are present. The one that I've showed you na naka-table. All 4 types of cells are present in this fundic glands of the stomach. Okay? What are the other characteristics? The terminal end is slightly coiled. The gastric pit occupies 1/4 thickness of the gastric mucosa, and the lumen is narrow. All you need to remember in this slide is that all 4 types of cells are found in the most numerous type, which are your fundic glands. And the last glands is the pyloric glands. In this picture, pyloric glands are actually malapit na siya sa small intestine, duodenum. No? This is the pylorus, and this is the pyloric sphincter kasi it will open now to the C-shaped duodenum or small intestine. Okay, so what are these pyloric glands? Pyloric glands are simple branch tubular glands. Their terminal end is extensively coiled. The lumen is wider, and there are no parietal cells, meaning pag parietal cells, walang masyadong hydrochloric acid secretion and intrinsic factor secretion. Okay? Except in the pyloric sphincter. But the whole pylorus or the pyloric glands, there are no parietal cells. Usually, predominantly, nasa fundic glands sila and cardiac glands ang parenchyma ng stomach, which are your parietal cells. Okay? Alright, so let's go now to the small intestines. Okay? So after all you need to remember sa stomach would be the cells and the glands. Okay? The cells and the glands of the stomach. Now, before entering into the small intestine, look closely, nagkakaroon na siya ng goblet cells. Pero pinaka-konting goblet cells ang makikita nyo sa first part ng duodenum. But still, meron na siyang goblet cells. Okay, just like the esophagus and stomach, there are also lamina propria and muscularis mucosa of the small intestine. Stretched na to ng buong small intestine. The submucosa, still, there are presence of the Meissner's plexus. No? Meissner's plexus, to be specific, they are your parasympathetic ganglion cells, and they supply the mucosal cells and smooth muscles, which are your muscularis mucosa. Meissner's plexus, as I mentioned, are responsible for secretion. Okay? What else? At the muscularis externa, take note, ngayon ko lang sasabihin na to, from duodenum down to your large intestine, I call ang orientation ng muscle ng muscularis externa. So, ibig sabihin, Doc, from the esophagus down to your large intestine, it is I-call, except in the stomach, okay? Which contains your inner oblique, middle circular, and outer longitudinal. And you also have this myenteric or Auerbach's plexus for peristalsis. Now, basically, the whole small intestine, kahit tatlong segments pa yan, magkakapareha sila ng characteristic. I will show you what differs one from the other, okay, in a while. Ayan, so this is your tunica muscularis. You have your inner muscular layer, inner circular and outer longitudinal. This is tunica serosa. And in between, this is actually a blood vessel. No, may blood pa sa loob. Pero we can't find at this slide, we can't find in myenteric or Auerbach's plexus. Ayun, ito pala. Okay? You have your inner circular and outer longitudinal muscle. You have your myenteric or Auerbach's plexus. Okay? Nasa gitna siya ng dalawa. I mentioned, kayo pa sinasabi, kapag nag-stimulate to, magko-contract ng dalawa, producing your peristalsis or movement. Okay, so another characteristics of your small intestine are the presence of the following. Number one, you have your plica circularis. Your plica circularis histologically, but anatomically, you may find it as valves of Kirk-Ring. Okay, valves of Kirk-Ring. Ayan ang tawag sa plica circularis sa small intestine. Kasi ang large intestine is plica semilunaris. Okay? Large intestine is plica semilunaris, while your small intestine are your plica circularis. Your villi, we may also find villi. These are the finger-like or leaf-like projections at the lumen of your small intestine. And that will differ you to the appendix kasi halos pareha sila ng isura ng ileum, di ba? Kapag walang finger-like projection na villi, it's appendix. Pero kapag may villi, it's the small intestine. Okay? Your microvilli, its function is to increase the absorptive surface because majority of the absorption will happen in your small intestine. Kaya dapat may microvilli ka. Oops. Sorry. Okay, so these are your plica circularis of the small intestine. Look at this area right here. The whole area is your plica circularis. So another plica circularis, your plica circularis. Okay, those are plica circularis of the small intestine. Kapag grossly, they're called your valves of Kirk-Ring. In the large intestine, it's not circularis anymore, it's your semilunaris. Okay? Alright, sa small intestine, actually hanggang large intestine, when we call intestinal glands or when I mention crypts of Lieberkühn, they are actually the same. Okay? The intestinal glands are the crypts of Lieberkühn in the whole small and large intestines. They are only found at the lamina propria. Okay, again, intestinal glands are crypts of Lieberkühn. They are only found at the lamina propria. So sabi natin, parang sa stomach, kapag may glands, meron ding mga cells. So these are the cells of the small intestines. Number one, you have your columnar cells. Your columnar cells are also known as your enterocytes, and that is the parenchyma of the small intestines, the enterocytes. You also have goblet cells, your Paneth cells, and your enterochromaffin cells, which will be discussed in a while. Kung ano itsura ng Paneth cells na yan. Okay? Now, intestinal crypts or crypts of lubricant or intestinal glands, they're the same. Look at this picture. If you notice, this is, as I mentioned, this is the villi sa lumen. Tapos, ito ang plica circularis in the small intestine. Look at this area. If you see this one, these are your goblet cells, right? Yan. Nakita niyo ba? Sorry, palitan ko ng color. Yan. These cells are your goblet cells. Kaya hindi pwedeng hindi sabihin sa lining epithelium na simple columnar with goblet cells ang lining epithelium ng small intestine and large intestine because there are some goblet cells. The secretion is mucus. What else? Look at this. This is the intestinal glands. Yung mga nandito. These are all your intestinal glands. And look closely. No, nakita niyo ba yung red staining cells at the bottom of the intestinal crypts? These are your Paneth cells. Okay? Paneth, P-A-N-E-T-H. Your Paneth cells. So, they have actually secretions. And basically, they're located at the bottom of the intestinal crypts. So, yun. Yung red staining structure, those are your Paneth cells. Yeah. So, I made a table showing you the different cells found in the small intestines, their characteristics, where are they located, and their function. No, basically the first four cells, enterocytes, goblet cells, Paneth cells, and neuroendocrine cells are mostly the most abundant. Okay, but the most numerous, which is the parenchyma, is the enterocytes or the columnar cells. These are tall columnar cells with surface microvilli, and their function is for absorption. So if they are the main absorptive cells of the small intestine, they are the most numerous, obviously, and they are the parenchyma or the characteristic cells. The goblet cells, as described a while ago, they are scattered among enterocytes, and they provide mucus lubrication sa intestinal contents. Okay, they also protect surface epithelium. Kaya nga the mucus not just lubricate, it also protects the surface. The Paneth cells, they are described as pyramidal in shape. They have prominent eosinophilic secretory granules at the apex. Look closely. Nakita niyo ba yung red? Kaya nga siya kita-kita sa crypts, sa base ng intestinal crypts. Those are your Paneth cells. Yan, Paneth cells, they provide the first line of defense against disease-producing microbes by secreting lysozymes. Okay. What else? Neuroendocrine cells they're only found if they're again silver staining or chromium staining. They produce locally acting hormones which regulate GI motility. But in the practical exam, we don't include neuroendocrine cells, stem cells, and intraepithelial lymphocyte. Just the enterocytes, the goblet cells, and the Paneth cells. Are we clear? Okay, so these are the cells of the small intestines. Now, this is just a representation of your fibroblasts, meaning connective tissue, your Paneth cells, which are found at the base of the cells. So these are the columnar cells or your enterocytes. Sabi dito, you have the enteroendocrine cells. So ibig sabihin, this stain uses silver or chromium staining. Okay? Okay, what else? This is another picture showing you the cells covering the villi of the small intestine. You have these goblet cells, the tall enterocytes, wala nga lang mga Paneth cells kasi nga nasa intestinal crypt siya, sa base ng intestinal crypts. Okay, Doc, paano to? These are your actually M cells, not discussed here, pero the cells pointed right here, kapag sinabi mong Paneth cells, hindi itong picture yung i-represent natin. Merong picture sa laboratory. Those pictures will be used in the practical exam. So basically, Paneth cells are found at the base of the intestinal crypts. Hindi sa may taas, no? Sa may base siya, itong mga to. These are actually Paneth cells, but this will not be used in the practical exam. Okay, now let's discuss the segments of the small intestine and their characteristic feature. The duodenum is the shortest, the widest, and the most fixed part of the small intestine. As I mentioned a while ago, duodenum is included together with the esophagus na merong glands sa submucosa, and we call this the duodenal glands of Brunner or Brunner's glands. They are found at the submucosa of the duodenum. Doc, ano tawag mo sa glands na makikita mo sa lamina propria ng duodenum? We called it as crypts of Lieberkühn or intestinal glands. Okay? So duodenum lang ang may glands sa submucosa sa lahat ng segment ng small intestine. Okay? Wala nang Brunner's gland sa ileum and jejunum. So, this is duodenal glands. So, look, Doc, ito yung intestinal crypts of Lieberkühn. Meron niyang mga goblet cells. If this is the mucosa, this is the submucosa, automatically this is your DG, not Daleheron. Okay? This is the duodenal glands or your Brunner's glands. So, pag tinanong natin, Doc, kung may Brunner's glands, what segment of this in the GI tract? It is your duodenum. Okay. Absorb the surface. Look at this. The circular folds, the plica circularis, kaya mas madaming ma-absorb kapag circular fold ang nandyan sa small intestine. Kasi nga, pagdating sa large intestines, magkakaroon na ng nagiging semilunar na siya. Semilunaris na siya. Plica semilunaris. This is taken in the laboratory orientation. If you notice, this is the intestinal glands. Okay. Now, this intestinal glands is composed of number 1, the columnar cells. Those are your parenchyma. Your goblet cells in here, and your Paneth cells, yung red staining. So, again, based sa table natin, please to know the functions, the location, and the the function and the location of these small intestinal cells. Okay, this is just a comparison of the duodenum, jejunum, and ileum. All you need to remember are the following. Number 1 is the presence of intestinal villi. If you look closely, they have intestinal villi. Obviously, because they are the small intestine. But look at the description of the intestinal villi. The duodenum, it is described as having a short, broad, leaf-like intestinal villi, while the jejunum is or has a long, slender, and finger-like projections or finger-like intestinal villi. That's the jejunum. The plica circularis is actually pinaka-developed sa kanya is the plica circularis, the jejunum. No? As we mentioned, meron pa rin sa duodenum and sa ileum ng plica circularis, pero pinaka-well-developed sa jejunum. Okay? Tandaan niya. Well-developed ang plica circularis. Anyway, intestinal villi description of your in the ileum is shorter and they are club-shaped. So itong tatlong to, please take note kung anong characteristic appearance ng villi. Goblet cells look from few duodenum, numerous jejunum, and more numerous sa ileum. Kasi ang most numerous na goblet cells are found at the large intestines na. So kung papunta ka na sa large intestine, mas marami na. I mean, pinakamaraming goblet cells sa large intestines. No? Kasi nga, ayun yung parenchyma ng large intestines. If your stomach's parenchyma would be parietal cells, enterocyte ang small intestine, pagdating sa large intestine would be goblet cells. Okay? The glands in the submucosa, Brunner's glands are only found in the duodenum. Okay? Wala nang gland sa submucosa. Alright, sa lamina propria, there are lymphatic nodules found in the duodenum and jejunum, but we have the pairs, patches, aggregates of lymphatic nodules only found at the ileum. Alam niyo ito since prelims, no? That the pairs, patches is found at the lamina propria of the ileum. Okay, look closely. Tingnan nyo yung length. Ang pinakamahaba would be the ileum. Widest in diameter would be the duodenum. Mesentery, ibig sabihin ng mesentery, sabi natin, absent na mesentery ng duodenum. Kasi ito yung most fixed, hindi siya gumagalaw. Ito mesentery, present sa jejunum and ileum, kaya gumagalaw din ang jejunum and ileum kasi nga meron silang mesentery. And the mobility, non-movable ang duodenum kasi nga fixed sila. While jejunum and ileum, they are both movable. Yan. So, in this picture is actually extracted from their laboratory orientation. Okay. Identify the part or segment of the small intestine. If this is your Brunner's gland, this would be duodenum. Okay? Look closely. These are aggregates of lymphatic nodule found at the lamina propria. So if this is the pairs, patches, this is your ileum. Okay? Now look at this plica circularis of this segment of the small intestine. They are well developed, most numerous. So this is the jejunum. Ayan lang ang tatandaan ninyo. The Brunner's glands in the duodenum, the pairs, patches of the ileum, and the prominence of your plica circularis in the jejunum. Okay? Wait lang, meron akong ginawang table. Anyway, mamaya ipoproject natin yan. For the large intestine, medyo mabilis na tayo dito. No? From the ileocecal junction up to the anal opening to the peritoneum, that's your large intestine. And it is composed of the following. Your cecum, appendix is not part of the large intestine, pero doon mo makita kasi yung opening ng appendix. You have the ascending, your transverse, descending, and the sigmoid colons, your rectum, and the anal canal. It is believed to be 5 to 6 feet long. So, asan po dito? This is the ileocecal. So, ibig sabihin ng ileocecal, if this is the cecum part, this is the ileum, part of the small intestine. Doon, nagkaroon ng junction, ileocecal valve. Now, look closely in this picture. You have this small appendix. So, dito nagkakaroon ng acute appendicitis. Nagkakaroon ng paglaki nito, nag-i-inflame yung appendix. Anong cause? Not known pa. Pero sabi na pwedeng fecalit, pwedeng may naipit. Yung opening nito kasi maliit lang. So kapag may bumara dyan, magkakaroon ng inflammation. And hindi mo pwedeng gamutin ng antibiotics yan. No? Kailangan mong maoperahan. Now, this is the ascending colon, your transverse colon, descending colon, your sigmoid colon, your rectum, and your anal canal. Okay? The mucosa, as I mentioned, it's plica semilunaris, but no villi in the large intestine. Sa small intestine, it's plica circularis, right? Look at the lining epithelium. Just like your small intestine, it's simple columnar with goblet cells. The lamina propria is rich in lymphoid cells, and there also contain intestinal glands or crypts of lubricant, and also the muscularis mucosa. They're the same. The submucosa is still dense. Ang pinagkaiba na lang is that of pinakamarami ng goblet cells talaga pagdating sa large intestine. Okay, in here, the tunica muscularis, the orientation of that muscle is complete ICOL, no? Inner circular, outer longitudinal in appendix, rectum, and anal canal. Pero sabi dito, in the colon or the large intestine, complete daw po ang inner circular. Pero ang outer longitudinal part niya will be formed of 3 longitudinal flat bands. Ano ibig sabihin nun? There is presence of Taenia coli pag nasa colon na siya or large intestine. Again, ICOL pa din sila, ICOL pa din sila, but for the part of the large intestine, the outer longitudinal part of the ICOL is formed of 3 longitudinal flat bands. So ganun pa din, ICOL pa din siya. Yun nga lang, nagiging 3 longitudinal flat bands, and that's what you call your Taenia coli. No, Taenia coli in large intestine. Okay, Haustra, when you dissect your cadaver, when you go into medicine at nag-dissect kayo ng large intestine, yung housing niya, that's what we call sacculations. Grossly, we call that haustra. Okay, sa large intestine. Huwag niyo na itong intindihin. Alright, so this is the mucosa of the large intestine. So basically, wala siyang villi masyado, and they are composed of so many goblet cells. So many goblet cells. That's what is wala sa appendix, no? Appendix, look, simple columnar with goblet cells pa din, pero they are composed mostly of the dense and nodular lymphatic tissue. The tunica muscularis is ICOL, and tunica serosa would be mesothelium pa rin. Look at the appendix. So, napakadaming lymphatic nodules. At hindi ito Peyer's patches. Kapag nagkaroon ng villi dyan, Peyer's patches na ang tawag dito kasi nasa ileum na kayo. Pero appendix, walang villi. Okay? Wala siyang villi. There are prominence of just lymphatic nodules. Okay, yan. Patapos na tayo ng digestive tract. Rectum, simple columnar with plenty of goblet cells. Huwag na nalagay ng plenty, just goblet cells din. The same, no? With all of the large intestine except for this one. This is the rectoanal junction. Pag sinabi mong rectoanal junction, of course, there's junction between the two organs or two structures. Look closely. Look at this lining epithelium here. It's stratified squamous, non-cornified epithelium. So, ibig sabihin, anal canal na to kasi stratified squamous na siya. Pero, this is, lagyan natin ng green. This is the junction. Alright? Ito yung junction niya. Why? Because this is still the rectum because of the presence of goblet cells. Yan mga yan. Plenty of goblet cells. And you have the stratified squamous. So this is the rectoanal junction. Wala kayong makikitang ganyan sa taas. Kahit stratified squamous pa to ng esophagus, wala kayong makikitang goblet cells sa stomach. Right? So these are, if there are plenty of goblet cells here, tas may stratified squamous na to, definitely this is the rectoanal junction. Okay? But look closely at the anal canal. Upper half would still be like merong goblet cells. May goblet cells pa din yan. Pero the lower half would be strictly stratified squamous, non-keratinized epithelium na siya. Okay? Okay, I made this, wala to sa pinadala kong PowerPoint, but look closely para madaling tandaan. The organ is stomach, small intestine, and large intestines, but the parenchyma differs. Parietal cells for the stomach, enterocyte for small intestine, and goblet cells are your large intestines. For the lining epithelium, they're all the same except for that stomach na without goblet cells sila. The lining epithelium of both small intestine and large intestine, please take note, dapat merong goblet cells sa lining epithelium. Is that clear? Okay, so that ends the lecture on the histology of the gastrointestinal tract.